Okay, we're going to go over the hypnotic anti-anxiety drugs. We've got the toxicities in red, and this is the visual mnemonic. You've got the eyes that are all hypnotic. So these are things for anti-anxiety and hypnosis or hypnotic. You've got the Pentabarbital up here. You've got the Pentabarbital. So this is Pentabarbital. And this is where the GABA opens up the chloride channels. One of the toxicities is the chief complaint is laryngospasm, but this is a barbiturate. It depresses REM sleep. That's what the REM is up top. It depresses REM. It prolongs open time for the chloride channels. Hypnotics are usually weak acids. It's metabolized by hepatic microsomal enzymes. So it's not for liver patients. There's many drug interactions. It's used for anti-anxiety. Now you've got the Zolpakam and the Zolpakam. This is Zolpakam and Zolpakam. These are non-benzodiazepine hypnotic. It acts within the GABA-A receptor, or the alpha one, increases duration of sleep, but little effect on the sleep stages. So it just increases the Z's. See, there you go. Now you've got a bus on a spiral. So buspirone. And this is an anti-anxiety drug with very little potential for abuse, so it lacks the hypnotic and anticonvulsant properties. Baclofen, see, backfin, the fin on the back, Baclofen. Baclofen is a para-chlorophenyl GABA antagonist. It's at the GABA-B receptor. So it's a skeletal muscle relaxant. It reduces spasms with spinal injuries or MS. Now you go over to the benzodiazepines over here. Most every one of them have something similar that they end in PAM or LAM. Most of them, but they've replaced barbiturates for use in hypnosis. Okay, this depresses stage 3 and 4 of non-REM sleep. Okay, they lack interactions with other drugs, so they do not induce these microsomal enzymes like the barbiturates do. So it's not for pregnancy, and the incidence of severity of CNS toxicity increases with age. So that increases toxicity with increased age. You've got Alprazolam, like Alakazam. So Alprazolam. There's that lamb. This is chosen for the elderly. It also has antidepressant and used for panic disorders. It says I am dependent because it tends to develop a physical dependence, so you've got to withdraw gradually. You've got Mr. Diaz. Mr. Diaz is in a pan, so it's diazepam. There's that PAM again. Longer duration of action. It's chosen for children, and it's a drug of choice for status epileptic. You've got also triazolam. It's the shortest half-life. High rebound anxiety, insomnia, so tolerance, and it says we tolerate you. Well, there's a tolerance develops quickly. Now over here you got a plume with flumes, flumanzenil. This is the antagonist for the benzodiazepines. It antagonizes the binding of the benzodiazepines, so it's used for overdose. Adverse effects can be convulsions. But basically, if you have an overdose of the benzodiazepines, you're going to use the flumanzenil. Now over here we've got the toxicity guy. So we're going to talk about the toxicities. Now the I don't remember is memory impairment. Basically, if you're in the ER and somebody brings in a friend or relative and they've got memory impairment and stupor, or they're in a coma, stupor is the question mark, they're slurring their speech, they have unsteady gait, and the B is for benzodiazepines. And also, if you look at the eye here, the eye movement, they've got nystagmus. And what we would use for this is the flumanzenil. So that's what you got to look for with any overdose or abuse.